A new method of treatment is reducing hospital stays for patients and treating their illness with less medication. A pulmonary embolism is a blood clot in the lung that can be deadly. But as On Your Side's Rich Donnelly found out, a team at HCA Memorial believes that it's developed a program that will save thousands of lives.
How you doing this morning?
Doing well.
I hope things are good. You feeling all right?
This is now a routine follow-up appointment at HCA Memorial for patients who had a pulmonary embolism. But until very recently, that was not the case.
A decade ago, we had very limited portfolio of treatment options for patients, and particularly just medications, blood thinners that we were giving them. And that had a substantially low outcome improvement in their survival.
3 years ago, Dr. Mohanad Beisharat and his team at HCA Memorial began offering invasive thrombectomy procedures to treat deep vein thrombosis and pulmonary embolisms. This type of procedure is not new, but what is unique to HCA Memorial is that they have a pulmonary embolism response team, or PERT team, on call 24/7. The result of these procedures is the total removal of a blood clot like this.
Being able to go in and physically extract the clot gives you this visual reward of curing the problem.
Take a look at this x-ray of a blood clot in the lung. Beisharat and the PERT team pull these blood clots out of a patient's lung. This is the result, the complete removal of a blood clot that's been taken out in one piece, and it's longer than a marker. To do that, they insert a catheter like this one into the patient's thigh. The patient is under conscious sedation during the procedure, which means they are sometimes awake.
That allows us to address the condition faster and mechanically extract the blood clots. I have been amazed with the amount of clots that we've been extracting from these cases.
According to Beisharat, the mortality rate of pulmonary embolisms decreased from 20% to just 1% since the PERT team went into effect. Furthermore, Beisharat says that the average hospital stay for a patient with this procedure is just 48 hours, compared to 7 days or a lifetime of blood thinner medication for previous treatment methods.
There's nothing in the history of medicine that changed the mortality of such a cunning disease in a short period of time. When you go to see the patient before the procedure, you tell them you have a large blood clot sitting in your lungs or heart. After 20, 35, 50 minutes of a procedure time, you just hand it to him in his hand and say it's out.
The PERT team has taken out 250 pulmonary embolisms with this procedure, but less than 5% of embolisms in the United States are treated this way.
I treated those patients or similar patients 7 years ago. We always had bad outcome expectations. I always tell their family members, like, this is a fatal disease. Nowadays, I have a different message for them. I'd say, there's a clot in his lungs, and I'm gonna go and get it.
HCA Memorial wants to make this procedure the standard practice of treatment for pulmonary embolisms across the country. Reporting in Jacksonville, Rich Donnelly, First Coast News, On Your Side.
All right, everyone, I'm on a special assignment outside of the First Coast News studios today, and you don't want to disturb